Now I'm going to listen to this dog's heart and lungs. We're about to put him out for a dental procedure, so we definitely want to make sure we listen pretty closely. So.
I know.
So he actually has a heart murmur, which we've notated before, but it's basically doesn't have the classic lub-dub sound to it. It's kind of got a whoosh every so often. So at this point, I would alert my doctor that he has a heart murmur, and we would probably adjust any anesthetic drugs accordingly. But his heart rate sounds good otherwise, and he's obviously fairly healthy aside from that.
I am self-taught.
His respiration sound good. His lungs sound clear. However, if he had any crackling in his lungs, or what sounded like crackling, that would be a time to alert the doctor, worry about fluid buildup, that kind of thing. So. Go. Now I'm going to attach my ECG monitor to my sleeping patient. So I'm going to wet my areas that I plan to place with alcohol, which will be the left hind, the right hind, and the right front. So I'll go ahead and attach. So then, so I have my red lead attached to my left hind, my green attached to my right hind, and then my white, which is attached to my right front. And then I will turn this on and we'll be able to monitor on our computer. Alright, so I'm going to show you, I have my restraint pole here, or rabies pole. And obviously she's not an aggressive dog, but in the case she was, you'd have this, and then we can hold her away, so that we can safely administer drugs if we need, or get her into a kennel without, having to get too close to her. So in order to take it off, you just kind of loosen it, and she'll back her head out. I'm going to put a urinary catheter in this dog. So first I'm going to clip the long hair around his prepuce, the sheath. And he is sedated. Okay. So now that we have it exteriorized, I'm going to go ahead and scrub it with some light surgery scrub. And then just some regular like fluids. This is a lactate ringer in this case. Okay, so now that I've clipped and I've scrubbed up there, I'm going to get my sterile catheter ready. going to go ahead and lube the end. And then I'll go ahead and advance the catheter. Okay, so now we weren't getting any urine, so his bladder is probably empty when we were trying to feel for it too. But I'm going to go ahead and pull the catheter out, and we'll let him wake up. Okay, so now we're going to get a cysto on Daisy here. She's been peeing in the house. Oh, it's okay. It's okay. Good girl, Daisy. Alright. Okay. So Dr. Beeman is going to use the ultrasound probe to find her bladder.
It's okay. I'm still big bladder.
And then he's going to insert a needle into her bladder and pull some sterile urine out for a urine culture. A urine culture. And we got plenty. And now we'll run that and see if she's got an infection. Oh. Okay, so now we're gonna do anal glands. This is Violet. So I've got my gloves on already, and Bria's gonna gently restrain for me. So we'll have her stand up. And I'll get her anal glands. They're at about 4 and 8. Maybe she'll share. There you go. Bye. Stop. So that was one side. Gently squeeze until okay. And there are anal glands. Okay, so now I'm going to put topical medication on my cat here. I have Frontline Gold. So with this, you just kind of twist it down and push at the same time to break the seal. And then with cats, you know, typically with Frontline, you put it kind of between the shoulder blades. With cats, we tend to go a little bit higher just because they're flexible and we don't want them to get around and lick it off. So I'm going to go ahead and kind of put it between the base of his skull, actually probably closer to the base of his skull. So I will part the hair. He might fight me on it, just because he wants attention. Get it clear down to the skin. Squeeze all of it on there. Kind of put the hair back, and that's how you apply topical medication. Now I'm going to show you how to clean ears and then medicate them on a dog. So I have my Epiotic, or just any general ear cleanser will work. You lift up the flap and put a decent amount in, and then kind of massage it until you hear the kind of a squish. I'll do her other ear as well. Hang on. And I'll let her shake here in just a second. And then I'll take my 4x4 or a piece of paper towel, and I'll go in and I'll kind of wipe out the extra stuff. Her ears are not super dirty. Oh, you're all right. Get any extra moisture out. And then this is my ear medication. It's just Tresiderm, but I will show how to put it in. So same thing, we'll put the ear flap up and put a couple of drops and let that soak in. And do that in both ears. Okay, so now I'm going to clean and medicate this cat's ears. This is my cat Haas. He's a good boy. So, take my ear cleaner. Yeah, I know. He doesn't like his ears cleaned. I know. I'll kind of squish it around. I'll take my gauze or a piece of paper towel, and I will go in and remove any dirt that I can get. His ears are pretty dirty. I'll get a fresh one for the other side. And then to medicate him, I have some Tresiderm. So I'll just put a couple of drops in each ear. She's not exactly a big fan of either. And that's how you clean and medicate a cat's ears. Okay, so now I'm going to do his tear test. I have my test here. I'm going to go ahead and open his eye, insert that down by the conjunctiva, and hold his eye shut. And we will let it run for about 60 seconds. We're at about 30 seconds now, and he's right at about 15, so. Got about 5 seconds left. All right, it's been 60 seconds, and he is right at 18. Okay, so now I'm going to do his eye fluorescein test, make sure he doesn't have any scratches or anything like that. So I have my strip here. get it open, maybe. And so typically when here, anyway, we've always kind of put it in a syringe, makes it a little bit easier to administer. So we take the tip of it off, and I take my eye wash and I put it in the syringe. And I'll put my plunger in. So then I have this all ready. I'm going to go ahead and administer a drop without touching it to his eye. He's going to cooperate, I don't know. I'll do this eye. Alright, so now that is in. Okay, and now I will run and grab my ophthalmoscope and look in and make sure he doesn't have any scratches. Okay, so now that I have my scope, I'm going to go ahead and turn it on, my light, and I'm going to look at his eye for any scratches or any places where stain uptake would be. And I do not see any, so I don't believe he has any scratches on his eye. So that, I will go ahead and rinse it now. And there we go. So now I'm going to mix up my enema and give it to this dog, but I'm not actually going to do the enema, but I will show placing the tube and everything. So I have my lube. Doesn't take very much. And then I have my container of warm water here, so I'll suck some of that up. Oh my God. Kind of mix it up in my syringe. And then I will attach my red rubber catheter. And I already lubed it before we went on screen. But then I'm going to have her stand up. And I'll lift her tail. And then I'll insert the catheter. And then if I was going to actually give this enema, I would go ahead and squirt all of this in. And then pull the catheter out and take her outside so she can go potty outside. And so to remove it, I'll go ahead and just pull the catheter out gently. And that is okay. So I'm going to give this cat some sub-Q fluids. So I've got my bag of fluids here. There's not a whole lot in it. It's just a partial bag. This is just for demonstration purposes anyway. And he is sedated. I have some other things to do, so we had his teeth cleaned this morning. So, all right. So I have my needle. I am using an 18 gauge needle for this, but I will come up by his shoulders and I will make a kind of a tent, and I'll poke into that tent so it's under the skin. And I will turn my fluids on and let it run, making sure that it's going into his skin and not leaking out somewhere else. We do this in cases of mild dehydration, and a lot of times with the drugs that I used with him, or just anesthetic procedures in general. If we don't do an IV catheter, we at least try to do some sub-Q fluids like this to help push the drugs and help flush their systems and all of that. So now that I'm done with fluids, I'll turn off my IV line here, and I will will gently pinch where I had given it and pull the needle out. And I pinch just so that it hopefully doesn't leak, but happens. So now he's got a little blub here of fluid under his skin, and his body will, over time, absorb that moisture. So. Okay, so now I'm going to do a modified Robert Jones bandage. I have some cotton I cut. We had a 8-inch roll, but his leg is a little bit short, so I cut it into 2 4-inch sections. I'm going to start down here. I'm going to put some stirrups on. I have my cotton, my vet wrap, my stretchy gauze, and then a little bit of tape. A trick that my doctor uses is to do stirrups, which I will show, but he feels it helps hold the bandage in place. So I will put some on either side of his foot. And he does not actually have an injury. This is just for the purposes of the video. Okay. So then I will take my cotton roll and I will wrap it around. I'll start down here, leaving his toes exposed to check for swelling and that kind of a thing in case I get it too tight. Come all the way up because we need to immobilize, let's say his break was in between, we need to immobilize the joints below and above. So then I will take my stretchy gauze and I will stretch it around. Just make sure all the padding is on nice and tight. But not too tight, obviously. There is that layer. And then I will go ahead and turn my stirrups around. Like I said, this just kind of helps hold it in place so the bandage doesn't try to slip off at any point. And then I will take my vet wrap . All the way up.
See you on Tuesday.
And then that is my modified Robert Jones bandaging. Now I'm going to show you how to safely remove a bandage from a dog. So, I have my bandage cutting scissors with the end for safety reasons. So I'll slip that underneath. And I will cut through all layers. being as careful as I can. To not damage his skin in any way. So then we would gently take this off. And that is the removal. Okay, so now I'm going to apply a modified Robert Jones with a splint. It's pretty much the same as what I had done previously. We're just adding the splint instead. So I'm going to make my straps again, like I had explained in the other video. Again, these just help hold the bandage and the splint in place. It's a trick my preceptor showed me. So I have my cotton, which again I have an 8-inch roll of cotton, but his leg is so short I needed to cut it down so it would actually fit. And we need a decent amount of padding here because the splint can do damage if it rubs or anything like that. So again, he does not actually have an injured leg. It is just for demonstration for this video purposes only. So I have my gauze on and my stirrups on. So now I'm going to apply my stretchy bandage. Again, leaving his toes exposed to watch for swelling or that kind of a thing. And if I didn't say previously, he is under some light sedation. And if his break was in between anywhere, we want to immobilize the joint above and the joint below. And this is where I would place my splint. It looks like it doesn't fit because of the padding, but it is fitting on there. So then I will take my stirrups. And then I will take my vet wrap. Make sure it's in the right spot here. Alright, so that is my modified Robert Jones with a splint. Now I'm going to remove my Robert Jones with the splint. So I'm going to start by taking my vet wrap off. And I have my bandage scissors again with the protective edge so I don't hurt him in any way. So I'll actually probably come down the side here and cut all of this away. It takes a lot to get through all the padding. Alright, so I will carefully remove the splint. And then carefully finish peeling the tape from the stirrups. And that is our removal of a modified Robert Jones with a splint. Okay, so now I'm going to apply an emergency bandage, like a pressure bandage. He does not have any cuts or anything, but we're going to pretend he has one on the front of his leg. So I have kind of a Telfa pad, a non-adherent dressing, kind of to absorb if he was bleeding. And this is all for purposes of the video. So I have my dressing, and then I also have my vet wrap here to help me apply pressure. So I will go ahead and put it here, and then I will wrap it really tight just to help stop the bleeding until he can get somewhere to get his sutures done. I'll leave a little flap just to get it for ease of use when we get in there. Okay, so now I'm getting dental x-rays. You're on to the right side now. So I'm going to take my probe and I'm going to put it at the back of the mouth. Can you get a close-up, please? And position down here so we can make sure when we shoot we get the roots. So there's that. I'll position this like that. And then we'll shoot. So we'll come in here and we'll make sure we have it up on the screen. And then we've got our button here. And we'll see what comes up. So there's that view, and we had already done the other side. So we'll show one more view of me taking them on the bottom here in just a minute. Okay, so now I'm on the bottom teeth. I'm going to get some of my other premolars and my lower right canine. So I'm positioning my probe like so. And I have a paper towel in there just to kind of help hold it in place. I'm going to position her just a little bit more the way I want. Alright, so let's go see what that gets us. So I have the correct spot that I want clicked here. As you can see, this was my previous one with my lower fourth and my first molar. I'll go ahead and fire. And then you can see my premolars and part of my canine, so I'll have to get another one that gets a better view of the canine root. But my exposure is also good. The computer helps kind of determine that. So let's see if we can get the canine a little bit better. Alright, so now I'm just going to readjust a little bit so I can get a better view of my canine. Okay. So then we're going to go ahead and shoot that one. So it still shows my premolars and a couple of my incisors. I gotta adjust my angle a little bit more here. So I'll retake that one. Alright, so now I'm gonna adjust this just a little bit more back to where I want it and see if we can't get a better shot of that root. So we're gonna go ahead and retake that one. My incisors. Obviously we have a couple we're gonna most likely remove because there's no bone holding them in. So we will probably extract those, but that'll again be up to my doctor. Okay, so now I am going to clean this dog's teeth and I'm going to crack some of the tartar off this big tooth. You want to come gently kind of scrape it off. And I'll also use my hand scaler to get some of the bigger chunks off as well. So, and then I will take, when I get some of those big chunks off, I will take my ultrasonic cleaner and I will clean up the teeth and get some of the smaller chunks off. I don't want to stay on each tooth for too long. I gotta keep moving.
I'm sorry, what was in the right ear?
And I'm going to go ahead and do that on all the rest of the teeth. And then I will have it come back when I am polishing. So, with dental care at home, typically certified veterinary dentists recommend brushing the teeth twice a day, just like you would yourself, to keep tartar and plaque kind of away. But that's not always possible it's not always possible. So there are things like Orvet chews and Tartar Shield chews that help scrape as much plaque and tartar off. Typically they recommend once a day. This is kind of a rougher texture, the Tartar Shield is, so it helps scrape it a little bit better. The Orvet it's kind of got a gummy center, and so when they chew on it, it helps pull it off, and they've proven that in a lot of different studies. So at our practice, we recommend these two just because they are certified by the Veterinary Dentist Association. Alright, I'm going to demonstrate how to catch urine on a male dog. This is Hiram, and I've got my ladle and cups to put the urine in when I'm done. I'm going to slide it underneath him midstream and catch the urine, and then pour it in the cups. So, let's see if he'll go for us. Come on, Hiram. Potty. That's how it's done. Okay, this is Kendall, and she is going to help me demonstrate how to trim nails on a dog. So we have this type of trimmer, or we have the guillotine type. I prefer the blue handled ones. And then we have our quick stop in case I catch her. So, Kendall, can you sit? Good girl. I will get her paw. I'll pull the hair back and I'll expose her nails. And then I will trim just a little bit at the end, avoiding the quick. And I will do that on all of the nails. Trim a dog's nail. And I am going to show you how to trim a cat's nails. First of all, he has a thunder shirt on, so he doesn't move a whole lot, and kind of helps reduce his stress. So I have here are two different styles of nail trimmers. I prefer the orange handled ones, but some people prefer the guillotine type. And then we have some quick stop just in case he bleeds. So, and then I will just push on his paw pad and expose his nail, and I'll just take the hook off so that I don't get the quick, and I'll do that on all of his paws. Oh, Gibby. And then I got one toe. Never forget the dew claw. And that's it. Okay, so excuse the barking, I'm back in the boarding run, but this is the run I'm going to clean for the video. We had a puppy in here and he peed underneath his bed. So I'm going to go ahead and pull the bed out. Toy and then his bowl of water. I'll go ahead and set this stuff up here. And I will grab my spray. And we use Kennel Care. So I'll go ahead and pump it a few times. And then lock it into place. I'll pull my trigger. Kind of spray it all over so that we can get it all disinfected. Especially the spot where he peed. Alright, we'll let that sit about 10 minutes and then I will rinse it. Okay, so now that's been sitting about 10 minutes, I'm going to go ahead and rinse the disinfectant away, and then I'll kind of dry it so that the puppy isn't exposed to any of the chemicals. Now that I dried it, I'm going to get his Norman is get him all set back up. We have a towel because he likes to play with his water. And then I will put his blankets and bed and toy back in. Norman. Keep moving. Okay, he really wanted it back. So, that is how you clean out a kennel.